And you may ask two people the same question and they're going to give you completely different answers. So part of that is working with the patient to understand what is important to them and thinking about, one, do I agree? Is that something that's beautiful to me? Because I also don't want to produce something personally that I don't think is beautiful or that I don't think will work with someone, especially with their face. And that's okay. We can have a difference of opinion, and you're going to find another doctor who's going to do that for you potentially. And that's totally cool. But there's no right or wrong about that. The problem that we encounter nowadays with all of these trends is, for instance, there's the fox eye trend.
Welcome to the Double Down podcast with Dr. D. I'm Dr. Paula Daleman, a triple board certified MD with a passion for helping you thrive at every stage of life, from your first steps into wellness to navigating menopause like a pro. Whether you're tackling weight, mastering menopause, or leveling up your health, this is your go-to space for transformation. It's time to double down on your health and your life. Let's get started.
Do the beauty standards we've been chasing for years actually help women feel beautiful? Or were they created by an industry that thrives out of endless pursuit of perfection, fueling consumerism? While younger women in their 30s are turning towards very invasive procedures out of fear of aging, women in midlife are redefining beauty, choosing confidence and authenticity, and trying to embrace natural beauty over impossible ideals. So, what does beauty really mean today? Continue with our conversation in midlife changes and menopause, redefining beauty, ethics, trends, and the social media effect. This conversation at its core, it's about aesthetics and how our inner feelings and mental perceptions shape our overall well-being. I'm Dr. Paula Daleman, triple board certified, and your host in Double Down with Dr. D. So we have a sweet treat today, Dr. Jeremy White, a double board certified ENT and plastic surgeon with over 12 years of experience in plastics. Please, Dr. White, introduce yourself.
Yeah, so Jeremy White, I hail from New York where I did all my education, and it took me a while to get over leaving New York, but little by little moved my way down south via DC. I did my training and my undergraduate and medical school all in New York at Columbia, then Einstein. Then I did my ENT residency. 1 year general surgery, then 4 years of extra fun doing ENT, facial plastic surgery, head and neck reconstruction, and head and neck cancers, and sinus and septums. And sort of that's how I started actually falling in love with plastic surgery. I really fell in love with it through that. And then I had to decide, am I going to do a facial plastic surgery fellowship or am I going to do a plastic surgery residency? I was at that really ideal time where to do a plastic surgery residency was an additional 2 years or 3 years. So I'm like, gosh, let me just go. I'm going to do it all. And you got, in my opinion, I got much more hands-on training doing that way with the general plastic surgery residency. So I ended up getting boards in both specialties. I do everything head to toe, but my passion and most of my work is really up here in the face. So I finished my ENT training at GW. Then I did my plastic surgery training at Cleveland Clinic, Florida. Got my boards in both specialties. I really just practiced plastic surgery, focusing on facial aesthetics. But the ENT training really came in handy because a lot of what I deal with is rhinoplasty, and I do closed rhinoplasty. I haven't done an open rhinoplasty in many, many years. And it was cool because during the training, I got a lot of exposure to both open and closed rhinoplasty. And it was somewhat unique in that perspective because most of the plastic surgeons really just do open rhinoplasty. And now you're seeing another shift in paradigm these days. So that sort of brought me to a unique expertise in the face because I was able to understand both the functional aspects of the nose and the cosmetic aspects of the nose. I was comfortable with a lot of techniques that a lot of the other plastic surgeons are not comfortable with. So it's really cool. Love what I do. The other part of my practice, I spend working with some dermatologists, which is also really fun. It's almost like a camp day for me because I go over there. I have there's a great, huge staff there. Um, and we just operate all day, but it's really fun because you get to help a ton of people in one day, back to back, with their skin cancer needs, with their reconstructive needs, teach them about the healing process, and also kind of think on your feet in that sense, because you often go in there and sometimes they'll ask me for a conversation beforehand. Oh, well, what are we going to do here? I'm like, truthfully, sometimes I don't know. And that's part of the beauty of this is I have to discuss the options. Could be anything from this to this, if it's something big. And sometimes you have to think on your feet and be creative. And, honestly, sometimes you go in there and you're like, gosh, what am I going to do here? And then, by the end, you're like, oh, that worked out pretty damn well. So it's like, yeah, you do have to be creative and think on your feet.
Room for creativity. So look at that. I gave you the option just to introduce yourself because I wanted to demonstrate to my audience that you were a sweet treat. But what you are is the whole combination of knowledge, experience, perspective from the ENT perspective, from the cosmetic perspective, from the dermatological perspective, which is as well a little bit of an extra on it. So with that, you are the star of the episode. I just want to start with almost introducing to my audience, which I'm trying to target women in midlife, making something very holistic. And I feel that you are that type of holistic doctor, despite all the diplomas that you have hanging on your wall, because we are going through a problem right now in medicine, and it's a big detachment between the physician and the patient. So that's why when we use the word holistic, which in my opinion has been overused, but really when we meant holistic is, let's don't forget that a patient, first of all, they are the slowly owner of their own health, and their perspective, it has to be validated, and we have to listen. So when we have to start re-listening in medicine. Decades, centuries ago, the doctor had to listen because it was the only way they could figure it out exactly what the patient had, and it was a lot of the semiology behind, right? What with questions will come out. Today, with so many technology, we don't listen anymore. The eye contact became a luxury between physician and patient relationship. I love the fact that you are first a doctor with a specialty. With we look forward for many reasons, and we're going to have the discussion here. But on the other side, a doctor who is understanding that listening and having that humbleness of, maybe I don't have the answer to you right away, but we'll figure it out together, because you trust your hands, you trust your creativity. Plastic surgery at the end is an art, right? So you are about to create a piece of art, and it's going to come out beautiful, but it's a commission piece of art. So the person on the other side has to have something to say. And let's start with a very unique question, and it's the perception of beauty. Just was mentioning how we are all changing that perception. It's so much noise around, and it depends of the stage that you are in life. I'm finding that the women that are going through midlife like me, we're trying to almost embrace that natural beauty again. Yes, it might require some procedures to go back into that natural beauty, but how do you think that out fashion, I would say, standards of beauty is starting to shift, and especially in this midlife kind of transformation that is happening in the 40s and 50s?
You touched a lot of different points about the doctor-patient relationship, how that's changed, and I'm going to try and focus specifically on what you were talking about. So, thank goodness that we are focusing again a lot more about what is natural, what is time tested, because there are so many fads and trends that come and go. Like you said, beauty's in the eye of the beholder. Different people may have different ideas of what is pretty and what is not, and that's okay. That's part of our conversation. I'll ask people, what do you think about this or that, or what is it that you like about this part of your face or this part of your nose, and what is it that you don't like? And you may ask two people the same question, and they're going to give you completely different answers. So part of that is working with the patient to understand what is important to them, and thinking about, one, do I agree? Is that something that's beautiful to me? Because I also don't want to produce something personally that I don't think is beautiful, or that I don't think will work with someone's, especially with their face. And that's okay. We can have a difference of opinion, and you're going to find another doctor who's going to do that for you potentially, and that's totally cool. But there's no right or wrong about that. The problem that we encounter nowadays with all of these trends is, for instance, there's the fox eye trend. Okay. And a lot of this was being pushed on social media. And I've seen these really beautiful 20-year-old girls women coming in and saying, I want the fox eye procedure. Do you do that? I said, well, it's a brow lift, or it's a corner of the eye lift, basically. There are two different ways people look at it. So like a lateral canthoplasty or a brow lift. And I talked to them about brow position and traditional aesthetics and ideals of beauty. And really, this is not something that's reversible, or certainly not easily reversible. So I've talked to many patients out of it, and that's okay. If that's what they want, they can go somewhere else. They can get that. There's still a big role for brow lifts. Absolutely. I love doing brow lifts, but it's got to be for the right patient. And I don't want to create anything that's going to look funny and that they're going to look back at it and say, oh gosh, 5 years down the road, maybe I shouldn't have done that. And now it's really hard to fix. We're seeing that come and go with, for instance, Brazilian butt lifts. I don't do BBLs. I have my own reasons for that. But it used to be a big trend that we were going to have big butts. And a lot of that was pushed by the Kardashians, or by their fame. And now that they're starting to downsize, now you're seeing people also starting to downsize or just request a little bit of a smaller augmentation there. Same thing with breast implants. We're starting to see patients request a little bit of a smaller implant size. I think my office has always been a little bit more on the conservative side when it comes to breast implants. I have more of that, perhaps that conservative New Yorker mentality to me, I guess. But, Miami, we look around Miami, it's, beach nation. So there's nothing wrong with it. You can have, very large breasts, and it's great. And for some people, it works awesome. But there are downsides to that. If you have long-term, large, really, really large implants, it stretches out the skin a lot. It thins out the breast tissue itself, and there are more problems associated with it. So pros and cons that you got to discuss. These beauty trends will come and go. I mean, I think a lot of it is pushed by, it used to be by the magazines. Now a lot of it is social media and influencers.
Agree. It is very interesting about the whole trends, Dr. White, because at the end, we're talking about younger women, the ones who are holding the fountain of youth, but obviously there is a discomfort within. And who is just firing up this? Is this social media? Is this so unrealistic? It's the world that we are living, and it feels like virtual. It feels like it's a non-real world. How do you approach that? How a 20-year-old will be approached and say, you might not going to like your eyebrow to be lifted in 10 years, and I'm not going to do this for you. Or you would say, okay, this is what you want, and we're going to do it in a conservative way.
Yeah, I think from my perspective, I'm thinking, about the patient's long-term goals, and I do want to help them. But on the other hand, I'm also thinking about what do I want out there? What's going to represent me as a cosmetic specialist and as aesthetic surgeon? And I just don't want people coming out of my office looking funny and me not being proud of what it is. So if I don't think that it's something that's really going to improve what they look like, then I'm just not going to do it. And it's simple as that. And I'll tell them, there's nothing wrong with that. There's nothing wrong with what you're requesting. That's okay. It's a trend. So I'll caution them. I'll try and educate them. I'll try and educate them about how I look at, for instance, an aesthetic brow. But some people are really just focused, and they're like, nope, this is the procedure. And actually, that's part of one of the issues that we encounter is you're mentioning technology, how that has changed the focus about who has the knowledge in the situation a little bit. Social media and the internet has played a big part in patients taken control of their health care and even now their beauty care. And part of the part of the issue is that looking something up online doesn't really give you the experience behind it. And so they'll see trends and they'll say, oh, I read somewhere on Google that this procedure is going to be best for me, or that whatever it is. And then they don't come to you with a question of, or with a problem and an open mind. They come to you and say, I want this procedure. And that makes the conversation sometimes a little bit more difficult to start, because they've already made up their mind. They want this procedure. I see truthfully, I see a lot of that with procedures like My Elevate, for instance. I like doing My Elevate. I think it's great, My Elevate, and I often combine it with radiofrequency energy. And I'll see patients in their 60s coming to me and saying, no, I only want a minimally invasive procedure to tighten my neck. And I want My Elevate because I read about it. And I look at them and their neck is like this. And I say, I'm so sorry. I don't think that this is the right procedure for you. You need a traditional face and neck lift, and I can make a beautiful, face and neck lift for you that will make you look very natural. It'll be very conservative. It will make you look much younger, youthful, and rested. And sometimes that conversation goes great, and sometimes, and it's okay. Sometimes they're like, nope, I want the My Elevate. And I will say, I'm so sorry then. I can't offer you that because you're not going to be happy in the end, and I'm not going to be happy in the end. And I want the best result for you. And that's part of the challenge of being a plastic surgeon, is that because I have all these other skills and I have all these other options for patients, I really have to help guide them towards what the best options will be for them. And also, they will hold me responsible for the results as well. Whereas a lot of times these days, it blows my mind. Like I saw a patient who had something like that, really, really loose skin on the neck. And she went to someone for laser, or microneedling, or whatever it was, minimally invasive things that they were doing. I'm like, I looked at her, I'm like, I'm so sorry. I would never ever offer that to you, because that would not do much of anything. And nothing against the person who was offering it, but the problem is when you don't have all the skills and tools in your toolbox, and you have one or two techniques, if all you have is fillers, everyone becomes a Botox and filler patient. And so I think we've kind of lost it as a society, because now everyone is doing Botox and fillers, and who's the expert in this particular situation? So they go and they'll go to their dentist, they'll go to their local primary care doctor or whatever, and that's cool. They may be very, very good at that, but it takes more than just a technique to provide the appropriate aesthetic service for patients, in my opinion.
Yes, and it's something that it can be applied to many other specialties as well. But unfortunately, something that became very profitable, like it is aesthetics in general, right? Because if we go a little bit in the history of plastic surgery, it really started as a reconstructive surgery. And then obviously it was amazed what we could be doing through reconstruction, that we could start like targeting things that it was making us look younger and more youthful. And now we're jumping into make me look someone or something that I'm not. So that's the problem. Is the scalpel is there, the hands are there, the creativity is there, but we need the ethics behind.
Right.
And this comes to my next big conversation with you, and is ethics and aesthetics. And obviously outside there in social media, nobody is regulating. Everybody can say, do, on, or portray whatever. And we can start with how much, for example, plastic surgeons who been fully trained and been going through the whole process of being a physician, a surgeon, a plastic surgeon, and subspecialties on and on, all fellowships. Now they could be totally criticized on social media for put in a before or after picture that and women being shamed, and but someone else who it has no credentials and no experience, no background, but is able to go and have put a hand on even fake cosmetics or cheaper aesthetics procedures are not accountable. Nobody rules on this kind of I don't know how to call them, if it's a provider or
Yeah.
is a person that is just like trying to be a plastic surgeon or an esthetician or a dermatologist when it's not. And it is absolutely, we have a problem here,
Yeah.
but that's what is, but that's what is like feeding into the social media, and that's what all of us, we are all getting that truth, that fake truth through that social media.
It's really wild because yeah, you'll see people talking on social media about their quick fixes and their all I do every day is I use yogurt and I mix it with this and that and this is my routine and look at me, I'm so beautiful. Like, yeah, you're 18. Like, you
Yes.
don't need to be doing anything special right now. But don't start thinking now as a 40-year-old that well I have to start doing this yogurt thing and this is what's going to change my life. And you talk about where do you get the expertise or where do you get these experts and their influencers. Part of it is I'm starting to see little by little is monetarily motivated because they're like, oh well, go to my Shopify account and buy these products that I recommended here. So that's one thing. That's an aside. But yeah, a lot of these things that people describe on social media just don't work, and they have no evidence behind it, no scientific evidence. I mean, you see these people talking about facial yoga and things like that, and uh, I even did a video about a review article that looked at patients who did facial yoga, and one, it was very hard for them to keep up with the process and the procedure of keeping up with facial yoga to see any changes, but the results and the changes were so minimal to none. And how can these people keep coming up on social media saying, oh, this is what I do and this is going to change your life? Well, it may, they may feel like it helps them and that's okay and there's no downside to doing it, but don't go out there and saying that this is better than a facelift or you don't need a facelift or something like that, or there's no evidence to that. So that's a big problem. And then the other part is the misrepresentation on social media, and that comes from two things. One, um, the aesthetic industry is notoriously poor about um, real scientific results and also about standardization of the results and how we're evaluating that. So I was looking up about exosomes, for instance, and exosomes has become, I'm sure in your world, right? You're starting to hear a lot about it. Have you started using it all, or?
No, no idea. I'm a traditional doctor, and the problem is that it's an industry that is moving so much money. The whole biohackers and
Yeah.
the supplements and tapping into your telomeres. Now you can tap into your telomeres, and go figure. I don't read those articles if they exist, but I don't think they exist yet. But the money, it is
Right.
going everywhere with that.
Money's there. So, there are two ways to approach it. You can say, like, well, they worked in rats and in mice, it grew some hair for mice. So awesome. We should start trying to do this as long as it's safe. And there's nothing wrong with that approach. But, you know, show me the photos, because my patients, if I'm going to start really believing in exosomes, which again, they may do a lot, and I haven't used them personally. Um, but if
So
you're,
talk to us about that exosomes. And I don't know. Because I don't read
yeah,
those things.
what are they? They're
Yes.
these little extracellular. So cells talk to each other, and they send signals to each other, and especially young cells. So what people are doing, or what scientists are doing, is they were taking young cells and they were harvesting these little packets of information that the cells send out with RNA and other proteins, and um, with the hopes that this is going to help, like you were saying, biohack. This is help going to restore youth. And so those particles are then harvested and used in certain preparations. So people are doing, for instance, microneedling, and then they're putting on the exosome on top, saying that it's going to change your skin, or saying that it's going to grow your hair. And that's great. I really hope it does. But I want to see the photos. I want you to.
But they're produced in a lab, so it's like let's say it's in a vial, and it's a liquid that they just inject or put on their bodies.
Yeah, I think officially you're not allowed to inject them yet.
Okay.
But they can be placed on topically after you make little micro channels, little openings, and so it's supposed to. So a lot of people are really into it. That's cool. This may be the wave of the future, and I hope it is. I hope this is something that solves a lot of problems for us. But as of now, I am not yet convinced by any data. I want to see photos. And the other problem that we see comes back to the photos. When you see photos, you have all the industry reps showing you photos of before and afters. And I've even seen this, it's horrible to say, but from certain doctors. There is a doctor who, gosh, I was looking at his after results. I'm like, wow, that's really, really incredible. And and you look at the before result, and you're like, gosh, I mean, like, I could never produce that in a million years, looking at that before result to the after result. That's truly just mind-blowingly incredible. And then I did a little reading, and I saw that one of the staff members outed the doctor, saying that he takes photos, the pre-op photos are done with a fisheye lens. So all of the central component of the nose is widened. The entire central face basically gets widened. And post-op, he takes a normal camera photo. I mean, it's ridiculous. It was a beautiful result afterwards. Why do you need to do that? Just don't do that. You're creating unrealistic expectations for other patients out there. The other thing, same thing with like some of these minimally invasive neck tightening procedures or things like that. You will see, or fat melting procedures. You will see the before picture is like this. I mean, I look horrible, I think. and then the after photo is like this, and they have this like great neck. Like, if you don't pay attention to those things, and you're the layman, you won't understand that all they're doing is they're changing neck position, or they're changing the flash. That the before photo is always like totally dark. There's shadows all over the face, and then the after photo and it's like some kind of skincare treatment. And the after photo is bright flash, and wow, their skin looks flawless. Like, yeah, all they did was change the flash. That doesn't mean that it didn't work. It doesn't mean that it's a worthless technology. It can sometimes mean that the result is a lot more subtle than what you're showing. So just be honest about it. Say, hey, this is a subtle result. It works. It helps to build collagen. It's great. No problem with that. Just don't try to deceive people. That really upsets me.
Yeah. And it's a marketing strategy at the end, right? So it's as much people that you can attract towards you. Eventually, you have to deliver. So it's going to be a moment that he won't deliver as he's promising through those fake pictures, or it's going to be worse. So this is a matter of time. It just crumbles because. But what amazed me is, like, there is no one to rule those kind of that world. We as a physicians, we're always ruled. Our malpractice rules us. The industry rules us. Even the pharmaceutical companies rules us. But a plastic surgeon cannot put a picture of before and after, a picture that it hasn't been edited wrongly, and because it's going to be highly criticized, because the whole shaming behind, right? So we are in this world where everything is so extreme. So now it's about how we shame women because they are going after certain procedures, when you explain to us very well that everybody has their own perception of their own beauty. And as much as you can guide them, you are not the one who at the end makes the decision. This is called an informed decision, and that's what we do with our patients. So it is, first, I feel that sometimes we get abandoned in this world. We were so regulated for so many decades that our social media arrives, and they continue regulating us, but whoever has no credentials are not regulated. And that brings me to the dark side, the horror movie of so many, again, I don't know how to call them, providers or experts that are doing procedures in a non very antiseptic environment. These horrible stories about plastic surgeries in a hotel room. That was a video going through Instagram of someone videotaping from another building a full surgery from a window to a window into a residential building. So this is something that is not, nobody, there is no policeman knocking on the door on that apartment. There is no medical, there is, unless something horrible happens, it's going to be the ambulance, but there is not medical bodies going after. There is not the association, the medical associations putting a hand on it. They only put a hand on us. We are the ones who are always keeping up with the procedures, the policies, the licenses, the whatever it requires. So I'm feeling that social media and not a lack of regulation is opening the door for many of these procedures that used to belong to certain experts, and today it has been it's been like the bulls in Pamplona. They just let go out of the biggest stadium, and everybody has to start running because you never know what is going to happen.
First of all, concerning awesome. That sounds like fun. You gonna go?
It is fun though. Yes. I did it in the 90s. It was fantastic. I have to, yes, that's cool. But there is many things that are out there, and I heard you about microneedling and things that, as long as there is not, like, if we keep the do not harm, right? We're physicians right from the beginning is do not harm. There is no, again, I don't know what kind of experts are those ones. I don't want to say estheticians because many people is an esthetician that is very well trained. I don't want to say there are mid-level providers because many of them are very well trained. But there is people who decided that they know just because they are good with their hands and are putting people at risk. And who is liable for this? And how we going to keep the public educated on how to take their own decisions? This is not an informed decision. This is a manipulated marketing strategy for you to make a decision that is going to make me profitable. Right. This is how I'm seeing this.
So regarding like nurses and PAs, hey, I know a lot of injectors, nurses, and PAs who are actually fantastic. They do really beautiful work, and I have no issue with that. As far as holding people responsible, ultimately in those situations, I think they are still responsible for being supervised by a doctor. So ultimately, the doctor is responsible for anything bad that ends up happening in those situations, which can be kind of tricky. There are regulating bodies like the ASBS, American Board of Plastic Surgery, American Society of Plastic Surgeons, that look over the plastic surgeons and the way that they conduct themselves as well. So there's that. But the people, the totally unlicensed practitioners that you were mentioning, I mean, yeah, thank goodness they do get in trouble. But unfortunately, sometimes it's only after something happens, like you mentioned. It's crazy when you hear, like you mentioned, that surgery was being done in some house somewhere. Was that a surgeon who was that a boarded surgeon in the U.S. or do you know what the story was? I forget.
That video was watched by 5 million people, and it was videotaped like on a 23rd floor, face to face, and they were grounded. But it was in a residential apartment building,
properly and things like that. If things go wrong, it's a problem. Yeah.
And most probably, what I'm just assuming, maybe if they're surgeons, they're just going to say, normally your surgery is going to cost X amount. We're going to cut it a half because we don't have to use the hospital. I don't know how this is working, but it's out of my mind.
Well, it sounds like a great deal, and I want to get into that because that gets into the whole the whole open world travel for cosmetic surgery thing. But one more mention about the unlicensed practitioners and just a cautionary tale because I see this way too often. You have the people who are just kind of dabbling in the industry, figuring it out on their own, or they went to a weekend course in liposuction, and now all of a sudden they want to do
Right.
liposuction on everyone, and they're perforating bowel because they don't understand. Hey, this guy had a prior laparotomy and is going to have a high risk of big problems, and nor do they know how to take care of them. Gosh, there's so many things that we can discuss from this, but about the non-licensed practitioners, because I can get back into that stuff.
Yes.
I'll give you a cautionary tale because there are so many people. You mentioned money being a concern, and so they'll find a cheaper option. If it's too good, if it sounds too good to be true, it's probably too good to be true. And I hear this so many times where I see a young, really beautiful woman, and she actually goes to the hospital because she's got a draining red buttock, and she says, well, my two friends, yeah, they went to this doctor. She was wearing a white coat and in a hotel room, and we were getting injections. We didn't really know what it was, and everything was fine with them, so I figured it would be okay with me. And ultimately it was some kind of a silicone or some kind of oil that was put in there. Unfortunately, this is a permanent problem. That person is going to be scarred for life. Getting rid of that stuff is nearly impossible because it's all over the place, without creating tremendous scars. And it's painful, and it's a draining sinus tract, which basically like stuff starts coming out of there ultimately. Sometimes they're fine for years, and all it takes is a little something to stir up trouble, and now they have the problem. So yeah, if it sounds too good to be true, it's probably too good to be true. So definitely stick with your board certified plastic surgeon, your board certified dermatologist, your board certified facial plastic surgeon for whatever it is that is aesthetic. Should be your go-to people for everything aesthetic. And again, nothing against going to a PA for Botox and fillers. Totally fine. There are a lot of them who are really fantastic. We were going on a different tangent though before, and that was a little bit about how, because of the expenses in the United States with regard to plastic surgery, a lot of people are going abroad now. So, for instance, they will go. A big tourist destination is Turkey for rhinoplasty and for hair transplants. It's a lot cheaper. Truthfully, I mean, a lot of these guys do beautiful work. I can't deny that. But what if something goes wrong? What if you're going to? We see this all the time. Truthfully, with South America, nothing against South America. A lot of great doctors there, but because we're in Florida, we see this. They go to Colombia, and they have their tummy tuck and lipo and BBL, totally fine, get discharged. They leave after a week or so. They come back to the US, and now they're developing an infection, developing a problem. Now they get a big open wound. They end up in the hospital. People try and help them, but they don't really want to take over because it's a disaster. And it's a real issue because now you're really stuck, or the patient's really stuck. Are they going to go back to Colombia to get them to fix it? Are they going to somehow find someone in the United States to take over and end up paying double or triple what they would have paid initially because now they have to fix up a really hard problem? There are certain things that I think are easier to travel for, like a hair transplant. Not too much can go wrong with a hair transplant. Fine, you lose some hair follicles. Okay, no big deal. You're going for a larger procedure, you're going for a tummy tuck or something like that. Listen, even in the best of hands, things can go wrong. And I really think that you're putting yourself in a bind to go abroad for these types of surgeries to save some money, because you're putting your life in jeopardy. Not only are the standards of care not the same in a lot of these places, but again, things can happen even in the best of hands. Then you want to be able to communicate with your surgeon and be well taken care of. In the end of the day, you got your one body, your one face, and you want to be able to trust that to the best and put yourself in the best situation for the best result. And
Well,
it
I have
costs
to
a lot
agree
of
with you. I have to agree with you on being consequent. I mean, always a surgeon or anybody in the medical field, whatever procedure we're going to be doing, we already put it's our responsibility to make sure that that patient starts on A and finishes through Z in a good condition. We have to be responsible of any consequences of what we do. Absolutely. That is just like I'm a little bit biased because I'm Colombian, and I have to tell you that I know all the plastic surgeons. It's like
I know
they are awesome.
very
Many of them
fantastic Colombian plastic
Brazilians
surgeons.
too, and but I can see how if something goes wrong down the road, what are you going to do? You're going to just keep the patient for the next 3 months in a hotel until you close a wound?
Yeah.
Or absolutely, I agree with that. But you see, people is making those decisions out of money.
Right.
So maybe I don't going to have this conversation about how much the health system costs, because mine not going to apply to Dr. White, the plastic surgeon, which many people is already used to it. I do lifestyle medicine. I do weight management. I do hormonal treatment for menopause and all this. And I'm not in the insurance world. I'm out of the network. And because I was with the system for a long time, and I got burnt out. Might not be your situation, because people is used to it that never insurance covered any type of aesthetics. So when I want something, I save the money to go and get my aesthetics, right? This is how people is making those decisions. If they really want something, and they really feel that botification, if it is the word, it will give them the self-esteem and the well-being, but might as well you save the money and you go for it. Now, going back into the beginning of this podcast, which artist you're going to commission your art to? That's what it is important, right? So this is when Dr. White puts his signature in his canvas after he does something. That's your responsibility. Not only is nice because that person is going to be your free marketing, but on the other side is your responsibility, absolutely, without doubt. And from that perspective, I totally agree with you. But this is how people is making decisions on money. And as much as I'm working at the level of the clinical level, and I think that good health is a right of a human being, I think aesthetics should be a right for anybody. Everybody should be able to afford them if you are in that state of mind. But just to start wrapping up a little bit on our episode here, I would love to hear from you maybe some advice that you can give to our audience regarding of staying safe on out there, on when to make their decision, how they can avoid not to fall into this big trap on this snake oil, whatever they are selling, or in procedures that do have some harm and made by people who are not licensed. And how are they going to know when the marketing is in your face, when someone is taking pictures with the wrong lens to make you believe something?
Yeah, it's getting more and more difficult, truthfully, to make those types of decisions. And it used to be that in plastic surgery, people would find out who to go to by asking their friend or asking their doctor or something like that. And nowadays, what do? They basically they go to social media or they go to Google and they search up like that. And that comes back to, well, marketing is taking over as opposed to, the other ways of just basically having a good reputation, being a good doctor in the community. So that's changed the game a little bit. But as far as making your decisions about who to go to, ultimately, I think, especially if it's a small thing, hey, ask your friend, that's a great way to start. Ask for recommendations from other people that you know who have other procedures. I think it's a really great way to start. Um, Google has a tremendous amount of knowledge out there, obviously, but don't get caught up in the hype. And especially if it's a bigger decision like surgery, you want to, one, I would probably see a couple of surgeons before you do any kind of surgery. Um, Make sure you share the same aesthetic goals, the same mindset. Make sure that the surgeon is board certified, at least if it's plastic surgery, board certified by American Board of Plastic Surgery, or facial plastic surgery in terms of face as well. Either or. If it's a dermatologic procedure, obviously, it could be any of those things. So those are important. Obviously, looking at before and afters, again, confirming whether or not you guys share the same aesthetic goals. But go to someone who you think is honest, who's going to have that conversation with you and spend the time, because a lot of times when people go to their clinics and they have a consultation, it's really like, oh, okay, you need a facelift, next, that kind of thing. And we spend 45 minutes to an hour talking to our patients about their health issues, if they have any, what are their goals, what are the different types of options, what is it that we may look at our current photos and say, okay, what do you like, what excited you about this, what did you not like about this, what was your concern about this, and then by that you can kind of tweak or understand better what is a priority for them. And then also someone who's going to be realistic, the surgeon being realistic as well, letting them know, hey, this is something achievable, and perhaps this is really not something that at least I personally can do for you, but maybe no one can really do for you. Because there are limitations. We're not just taking a Facetune. Sometimes people will come in and they'll say, oh, can you do morphing? Say, truthfully, I prefer not to do morphing, because with morphing or with any other kind of software, I can do whatever I want. I can put your cheekbone up here like this, and that's fine if you think that looks beautiful, but it's not something that I can really achieve. So I'd rather give you my knowledge, show you real photos, try and educate the patient, and then come up with a game plan together that works with their lifestyle, works with their goals. They may not decide to do surgery right off the bat, and that's okay. We have other options, whether it's to just wait it out or to maybe do something more minimally invasive. Sometimes I'll see a patient who's kind of on the earlier, like I'm seeing patients in their 40s these days. I never would have thought, I'm in my 40s. Okay. I never would have thought that I would be seeing patients in their 40s coming in for face and neck lifts. But truth is, especially with the weight loss revolution, which you're seeing a lot, right? And
yes,
patients are losing weight, and they're losing weight in their face, and everything's coming down. But so these patients would benefit from surgery. And not only that, why should they wait 10 more years before getting it for them to enjoy their life and enjoy the way that they look and feel young? I mean, when the mirror does not match your internal strength and energy, there's something you can do about that. And there's nothing wrong with that. And so sort of like something switched in my mind when I started seeing this, gosh, it was sort of a scary thought at first, because again, I'm in my 40s. But there's nothing wrong with it. And those patients actually can get much better results doing these procedures earlier, because their tissues are better. There's thicker tissues. It's not a first time facelift on an 80-year-old woman who has paper thin skin and nothing holding up anything and no fat content. I don't see a reason anymore for them to wait, because one, they can appreciate the result for a longer period of time. The tissues are better in their 40s, so it's not this 90-year-old paper thin skin with no fat content underneath it, where you have to really try and rebuild everything, and sometimes it's really impossible. I'm not talking really 90, but you get the point.
yes.
When you're 40, you can get a really beautiful natural result. And why should they wait? Why should they wait any longer? They want to look gorgeous. They want to feel that same energy that they have inside and have it reflect on the outside. And that's awesome. Go for it. So my mindset has sort of changed as I've gone on with that, because we didn't talk about patients like that during residency, or people, a facelift. You thought of facelift, oh well, that's for older people. Gosh, now I guess now I'm one of those older people.
We're redefining beauty. We're redefining aging as well. And but just to summarize the way how you can guide someone, I would say one, just a little of investigation. It's very easy with internet now, knowing who your doctor is. The board certification, I think it is important. It's easy, it's free. They can perfectly go to the Association of Plastic Surgeons.
I'm certified by the American Board of Plastic Surgery.
There you go. The American Board of Plastic Surgery for sure was going to have a directory. Second, I agree with you. Shopping around for your doctor is going to be, it's your savings going for him.
Yeah.
It is a good idea. And most of the plastic surgeons and other providers in aesthetics are happy to meet and greet to see what's the expectations. And three, we all humans, we know when the other person is listening and to guiding us right. It's obvious. I had a friend of mine who actually met with 10 different plastic surgeons before she was doing her augmentation. And I'm like, wow, my God, you have time? You have time for that? Oh my goodness. And she's like, it was so important for me to know their personalities. Even if I'm going to be asleep, I want to know exactly who was taking care of my body while I wasn't there. and second, their opinion on how do they manage things. They cannot be thinking that we're cattle passing by and they're just putting silicone on and on. And I'm like, I agree with that.
Yeah, and that's actually a big problem in Miami, and it's becoming a problem throughout the country, where we have private equity and just large corporations creating these centers, these aesthetic centers. We see so many of these in South Florida, and like you said, they're herding cattle, and they know it. Patients know it because the surgeon's there from 6 a.m. till 10 o'clock at night putting in breast implants. Gosh, that's got to be exhausting. But not only forgetting about the fatigue factors in that situation, but is that the way you want to be treated as a patient, number one? And number two, when things go wrong, because inevitably someone will have a problem. Like I said, no matter how good you are, you operate enough, there are going to be problems, complications. How are they going to manage that? Or are they going to manage that? Because again, when I take call, I see these patients coming in from even post-op day 0 or post-op day 1, and they just go straight to the hospital. I'm like, did you call your doctor? Did you speak to anyone? Did anyone pick up the phone? Did they schedule a post-op appointment for you? The answer is typically no to everything. There's no communication. There's no post-op care. They basically operate, kick them out, next, see ya. And there's really maybe they will see some other lower level provider for post-op down the road, potentially at some of these places. But usually you ask them, they have no post-op appointments with their doctor. Usually the answer that I get from these patients who've had problems with some of these centers is that they had really no post-op care with any of their doctors. Maybe they saw some other lower level provider within there, or I don't even know if they were even a medical practitioner. But it blows my mind that someone can go into a situation like this, get real surgery, and then not have a post-op protocol process. Have that follow-up with the doctor. Because again, even little things, if you catch them early, you can address it. But the issue is that they don't answer their phones, they don't schedule appointments, there's no semblance of post-op care. And that communication starts off from what you mentioned before, like a lot of that loss in the communication between the doctor and the patient. Perhaps that's almost become expected, like what you said, and maybe people don't care about that anymore. But I think it's still so important, because a big part of how your result is going to end up is going to be that communication and that post-op care process that you're going to need post-op. So
That's key.
those are my sense about it, is that you really need to have a good rapport with your doctor, make sure that they're board certified, make sure that they're going to be following you throughout your post-op care. How do I get in touch with you if there's a problem? Make sure that all of that's in place. I hate to think about other things like sanctions by the boards and things like that. I'm sure that's few and far between, but bottom line is usually I know it's a lot cheaper, but it's probably safer to stay away from a lot of those centers where you're getting kind of herded like cattle, like that, unfortunately.
Well, Dr. White, thank you. You really gave us a full tour of what is happening in plastic surgery right now, and maybe things that are going to come in the future. How do you see the world of aesthetics and plastic surgery in the future?
I'd like to think that I'm not going to be replaced by AI yet. So hopefully that doesn't happen in my lifetime, but I do think that we're going to be incorporating more of that in some way, shape, or form, at least in the medical industry as a whole. The question is, how will that fit into aesthetics? Will I have ultimately a computer where I can put someone's face in there and say, okay, well, he wants a nose that's shaped like this, and then put that into the computer system, and it'll put up a picture and print something out for me, like, okay, that looks great, print, and then all of a sudden to have this robot come over, like, hey, that would be super cool. Will that happen in my lifetime? Probably not. I think in the next couple of years, we're probably going to see a lot of the stuff that you're doing get integrated more as we begin to learn more about these growth factors and how to integrate them into aesthetics and how to really slow down the aging process rather than just reverse the aging process. I think that's going to be a big part of it. Probably one of the easiest things that we can do that's low tech right now, truthfully, sunscreen, eat right, exercise, probably, decrease your sun exposure, don't smoke. Those are simple things, and to slow down your aging process. But
this is not reinventing the wheel in there. You're right on.
I think the future is you, truthfully, slowing.
Funny, which is almost going back into the past. This is what grandma used to say: put your sunscreen, don't smoke, and brush your teeth. And I truly believe in the artistic side behind aesthetics and plastics, and who is touching you. The hands of the artist is the Picasso. Yep. That's why I don't think
look like
that say that again.
Hopefully they don't end up looking like a Picasso.
No, neither Picasso at the end of his pictures, but it is so unique, so artistic that's why me too. I will question the AI there. It's not like a neurosurgeon. I would say, with all due respect to the neurosurgeons, it will be easier. A very specific removal of mass in the brain. It will be easier than finalizing something that is so unique to the aesthetics of someone, especially when that someone has their own perspective of beauty. That's where, plus, don't forget the most important ingredient in here, and is the psychological part, which is how you are almost reading the person that you have in front of you, that understands that those aesthetic changes are maybe not coming from his psychiatric part, and is more coming from, no, this is me, this is my well-being, I'm sure I am doing the right thing. Some things are obvious, right? Some things is like, look, I spoke to you before. With age, my eyelids are falling. Eventually, I want to wake up in the morning and open my eyes. So it is right. Plastic surgery. Somehow it's reconstructed.
And that's a functional thing. But you mentioned the psychiatric part is, part of what we do, or at least what I feel like I do, is sort of psychology, in the sense that I have to understand how they feel, trying to understand how they want to look, but also make sure that they have realistic expectations, because some people do not. There is a certain incidence in the general population. I think it's somewhere around 2%. That sounds incredibly high, but of body dysmorphic disorder, where people have this altered sense of the way that they look to the outside world. And people who seek plastic surgery have a higher percentage of that. And especially patients who seek rhinoplasty have an even higher percentage of that. So sometimes that makes my job a little more difficult too, because you're interviewing me as a plastic surgeon, but I'm interviewing you too. And I want to understand, is this something that I can accomplish? Are these patients' expectations reasonable? And not only from an outcomes perspective, but also from a life-changing perspective. Is this person chronically depressed and hoping or thinking that getting plastic surgery is going to change his or her life, get him a better job and a girlfriend? It might, but I don't ever want to promise that. That's, what if it doesn't happen? That's not something that I can deliver on. So, or even someone who focuses on, a millimeter imperfection that they have, and I look at that and I say, well, yeah, I see it, but that's bothering. I'm thinking it's bothering you a lot more than what I would expect it to bother you in this otherwise beautiful face. And sometimes that means that I have to say, I might not be the right doctor for you in those situations. Both for really for their protection and for mine. I used to discuss this more with patients. I only had one patient ever in my career to call my office afterwards and say thank you for having that discussion, because it kind of opened up their eyes, like, oh gosh, maybe I am unrealistic. Thank you for giving me a psychologist's number to discuss this, because there are a lot more emotional overtones, and truthfully, going through a post-op recovery process is an emotional roller coaster process. So
Correct.
I typically don't go over the subject too much anymore, having been through that. Most people are not so happy to hear about those types of thoughts. But, like I said, it's just the reality of things that perhaps, okay, I don't think I can achieve your expectations. That's it. It's like, maybe someone else can. And maybe that's just me being humble, and I think that's also important.
It's being truthful.
Yeah.
It's being truthful. It's being ethically appropriate. That's what it is. Because unfortunately, I would say one of the specialists that is always, even within the medical field, within all of us, that we are always discussing about ethics, it is the plastic surgeons. Because until one, right, we start seeing like plastic surgery is fixing something that for us we don't see as a disease. Regardless, that can be a totally all new podcast about it. I do believe that it is important because it's part of your well-being. I'm a holistic doctor. I see that as long as you are comfortable with yourself, that you were explaining before, you are doing good to your health mentally and physically. So yes, plastic surgeons are important. I love plastic surgery. It's an art again, but you have to be ethically appropriate. You cannot believe that this is just the business and period. This has to be something that I am taking responsibility, and I'm looking at you, and regardless, I want you as a patient. I know that you have to go through another specialist before the psychiatrist, the psychologist, or even just a family coach, whatever it needs.
I don't have routines. I don't have like a routine like psych evaluation on anything. I never require that, but you can get the sense sometimes just from the conversation that perhaps they're just looking for something. They're depressed, and they're really hoping that surgery is going to make them happy. And unfortunately, that happiness, it comes from within. That's not something that you can change on the outside. And that's a lot of people's personal struggle, and that's okay. I mean, depression is it's a medical illness, and there are people who can help these patients, but it can't be me. I'm not going to be able to fix that. So, same thing.
It's a tool.
Confidence comes from within, but if we're making
Yeah.
tweaks and I can help rejuvenate your face and make your nose look better, or fix your, give you a mommy makeover and fix up that tummy and make you feel awesome in your bathing suit again, fantastic. It makes me super happy. It makes you super happy. Hey, everyone's a winner. But there's some patients, unfortunately, who need extra help and are perhaps need to be in a better place before they can get surgery.
Thank you for this long conversation. It has been very enlightening, and I'm sure we're going to have a lot of listeners being so happy and grateful that they could listen to you. And it's a treat. I said it's the full cheesecake. And Dr. White, please let us know how our audience can find you.
Yeah, so you can look us up on our website. It's arcplasticsurgeons.com. That's our website. My Instagram is at Dr. Jeremy White, MD, like medical doctor. We're also on TikTok. Yes, somehow I got on that, but makes all together. And where else? Yeah, that's pretty much it. Just give us a call. We do virtual consultations if you're from out of town. Obviously, I always prefer to put my hands on the patient myself. So even if you're from out of town, I don't want to meet you the day of surgery. I meet you beforehand, and we'll be able to do a full exam and everything like that. So really important. But in any case, that's how you'd find me. We're in South Florida. My office is in Aventura primarily, and also a secondary office in Fort Lauderdale. So come visit anytime.
Thank you so much. And am I going to invite you in the future because we have a lot to talk?
Awesome. Sounds like fun. See you again soon.
Thank you, Dr. White.
Thank you for listening to the Double Down podcast with Dr. D. If today's episode inspired, empowered, or gave you a fresh perspective, please don't keep it a secret. Subscribe, leave a review, and share it with someone who's ready to take their health to the next level. Stay inspired, stay committed, and I'll see you next time.